Heath Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Heath Watch, presented by UMass Memorial Healthcare. I'm Chandler Walsh. Today's topic is shingles.
Shingles is actually a name for a disease called herpes zoster. And herpes zoster is a viral infection. It's actually caused by the virus varicella, which is what causes chickenpox. Shingles is actually a reactivation of the varicella virus, where it comes back and causes a rash. The rash can be painful. It often looks like blisters, and it comes out on usually one side of the body in kind of a stripe fashion. Shingles is actually the chickenpox virus come back as a rash and later in life.
What are the symptoms?
Usually it is the rash that you see first. It can start as kind of red bumps, but then just turn into like a blister-like rash. Some people get an atypical rash where it doesn't blister but can actually cause ulcers or look kind of like bleeding. Sometimes people get a pain before they get the rash. Because the virus actually lives in the nerve root, it lives in our sensory nerves, which is what helps us feel. The rash is often very painful when it starts, and sometimes the pain can actually come before the rash. In very rare cases, sometimes people just get the pain and never get the rash.
What are possible complications?
So the most common complication is something called post-herpetic neuralgia. So that's actually a pain that lasts well beyond the rash. So that is the most common and probably debilitating complication that we see from shingles. That is when the pain actually lasts 4 months after your rash has actually gone away. And because it's a nerve type pain, it can be very difficult to treat with medications. There are other complications of shingles, usually in people that have weakened immune systems. Sometimes they can get a rash that covers their whole body and actually looks like chickenpox. Sometimes the virus can go to the brain and other organs in the body. But it usually only happens in people that have very weak immune systems from some other illness.
Are there treatments for shingles?
There is an antiviral medication that can treat the virus. If it started early, it's been shown to decrease the time that you actually have the rash and can possibly decrease the rate of that post-herpetic neuralgia, or the pain that lasts longer, but that's not been shown to be as definite. That medication is either acyclovir or valacyclovir, also known as Valtrex. It's usually best if started within 72 hours of getting symptoms of shingles. But in people, again, with weakened immune system, we would recommend starting it no matter when you seek medical attention.
Can you catch shingles from an infected person?
Shingles is actually your own body's virus. So when you're young, or if you've actually had chickenpox, that virus, again, lives in our body for the rest of our life and stays in one of our nerve roots. So you can't actually catch shingles from somebody else. But if you've never had chickenpox and never been vaccinated, or for some reason your immune system is weak and you kind of lose your protection against chickenpox, you can catch the virus from somebody with shingles. It wouldn't necessarily give you shingles like that rash, but you could get chickenpox from them. And so it is recommended for those that have the shingles rash to make sure that they keep the rash covered when they're out in public. Very rarely, people, especially people with weakened immune systems, can actually spread the virus through through breathing. And so in those patients, if they're in the hospital, we have to keep them in a special type of precaution so that they don't spread it to other folks in the hospital.
Can you get shingles more than once?
You can, unfortunately. So it's pretty rare, but I think it's somewhere between like 1% and 4% of people will get a second episode at least of shingles. We don't know why some people would get it versus others, but yes, you can get it more than once.
Why do some people develop shingles and others don't? Does age matter?
Definitely more common with age. So your risk of getting shingles goes up significantly after the age of 50. So they say about 30% of people in the United States will get shingles in their lifetime, but between the ages of 50 and 85, about 50% of those people will get shingles. So your risk goes up a lot after the age of 50, and also if you do have a weak immune system from being a transplant patient or on chemotherapy, then the risk of shingles would go up with that as well.
Who should get vaccinated?
Right now, the ACIP recommends anyone over the age of 50 should get vaccinated for shingles. Currently, as far as I know, most insurance companies will only cover if you're over the age of 60.
How effective are the vaccines?
There's 2 vaccines for shingles. The first vaccine we had was called Zostavax. That's actually using a live virus that's partially killed to do the vaccine. That was relatively effective, but a lot of people weren't candidates to get that vaccine because it is a live virus, so it's not safe to give in people with weakened immune systems. We do have a new vaccine that's been out for about a year, I think. It's called Shingles. It's actually made differently, so it doesn't contain live vaccine. It's called a recombinant vaccine. It's given in 2 doses, 2 months apart, and it has been shown to be very effective at decreasing both getting the herpes zoster or shingles and to decrease the rate of that post-herpetic neuralgia pain.
If I've had the chickenpox, can I still get shingles?
Really, the only way you'll get shingles is if you've had the chickenpox before. There are rare cases of it happening otherwise, but really it's your own chickenpox virus that you acquired that comes back as shingles.
If I've had chickenpox, should I still get the vaccine?
Definitely. So the vaccine, again, is going to help boost your immune system to prevent that chickenpox virus that you have in your body from coming back as shingles. So it's actually not recommended to check whether or not you've had the chickenpox with blood work before you give the Shingrix vaccine. It's recommended to give to everybody, even if you've had shingles before.
Can stress affect the onset of shingles?
It's hard to say. It's very difficult to study that. What we do know is that when people get shingles, usually they have some insult into their body. So they could be sick from something else. It has been shown to be associated with a physical trauma. It's hard to say whether or not it's associated with an emotional stress, but certainly if your body is under stress from some other physical ailment, it is possible at that time that your shingles could start at that time. So it kind of like kicks you when you're down.